Welcome, nurses. This is NMC Cbt 2023 Most Common Questions Part 1. A nurse is caring for a patient with temperature of 34.2 degrees Celsius in an acute clinical area. They have added blankets and given warm tea. What else can the nurse do to aid the hypothermia? A. Give them a warm bath. B. Get a warming device and warm them slowly. C. Give them extra blankets. What is your answer? B. Get a warming device and warm them slowly. Question number 2. Patients with Parkinson's disease is taking MADA4. What is essential to these medications working effectively and preventing patients' deterioration? A. It is given with food. B. It is given at night only. And letter C. It is given on time. What's the answer? It is given on time. Number 3. Recognizing and reporting any situations, behaviors, or errors that could result in poor care outcomes is called A. Duty of care. B. Duty of candor. Letter C. Duty of practice. What's the answer? Letter B. Duty of conduct. Number 4. The patient is being discharged from an NHS mental health inpatient unit and a supported housing placement has been found. They do not have the ability to make decisions about their health and well-being, and they have no friends and family who can help represent the patient. A. Independent health assessor. B. Financial advisor. C. Independent mental capacity advocate. And letter D. Non-medical prescriber. What's your answer? Letter C. Independent mental capacity advocate. Number 5. A nurse is caring for an individual with learning disability and their behaviors makes them very angry. What is the correct course of action? A. Do not disclose feelings about the individual's behavior and continue to provide care. B. Discuss feelings with the nurse in charge of the unit and try to understand reasons for the behavior and reactions to it. Letter C. Ask the manager not to allocate them to care for the patient. Letter D. Write in the notes about how they feel. What is the answer? Letter B. Discuss feelings with the nurse in charge of the unit and try to understand the reasons for the behavior and reactions to it. Number 6. Studying past experiences to improve practice in the nursing field is called A. Reflection treatment. B. Reflective process. C. Reflective studying. And letter D. Reflective practice. What's the answer? Letter D. Reflective practice. Number 7. A nurse in charge on a ward received a message that a relative has telephoned and made a complaint about her son's care. The complaint is that her sons appear to be losing weight and looks neglected. What is the correct nursing action? A. Collect reports from the staff on duty so that there is a clear understanding of the issue. B. Contact the mother to discuss her concern. Letter C. Write a detailed account in the son's notes and do not phone the mother. What is your answer? Letter B. Contact the mother to discuss her concern. Number 8. What essential documents that a nurse requests or refers to when caring for a patient with a cognitive impairment to aid delivery of quality care? A. Hospital notes. B. All about hospital passport. C. A GP report and latest discharge summary. And letter D. Treatment escalation plan. What's the answer? Letter C. A GP report and latest discharge summary. Number 9. Position a patient on their front to aid respiration is known as A. Proning, B. Supine, C. Tripod, and letter D. Log rolling. What's the answer? Letter C. Tripod position. Number 10. What is the target oxygen saturation of a patient with respiratory disease who is known to retain carbon dioxide? A. 84 to 89, B. 90 to 100%, letter C. 92 to 96%, and letter D. 88 to 92%. What's the answer? Letter D. 88 to 92%. 11. Which of the following help to identify hazards in the workplace? A. Clinical examination. B. Risk assessment. C. Audit. Letter D. Workload analysis. What's the answer? Letter B. Risk assessment. Number 12. What advice does a nurse give when teaching a student on the adult orthopedic ward about preventing the spread of infection? A. Wash hands at start and end of each shift. B. Use the correct personal protective equipment when required. C. Use infection control measures only when infection is present. And letter D. Apply hand gel after touching a patient and a mask at all times. What's the answer? Letter B. Use the correct personal protective equipment when required. 13. A patient attends the accident and emergency department saying that she is in a lot of pain. The patient is known to be drug dependent. The doctor prescribed opioid-based medication. How can the nurse prevent this from happening again? A. There is no point in trying. Patients with drug-seeking behavior are manipulative. Letter B. Advise the reception staff that the patients who appear to be homeless should be sent away from home now. Letter C. Speak to all the doctor and remind them about patients who have drug-seeking behavior. Letter D. Present the case at the next multidisciplinary supervision sessions along with data and information on drug-seeking behavior. What is the answer? Letter D. Present the case at the next multidisciplinary supervision session along with data and information on drug-seeking behavior. Number 14. How does a nurse evaluate the quality and effectiveness of the care they provide? A. Use the thank you cards received as positive feedback. B. Undertake and authorize feedback from the patients and colleagues. Letter C. Ask on The bank nursing staff to give verbal feedback. Letter D. Ask friend to fill in a questionnaire on their performance. What is the answer? Letter B. Undertake and authorize feedback from the patients and colleagues. Number 15. How does the nurse involve an acutely mentally ill patient when planning care? A. Read plan to the patient. B. Involve the patient in planning care even though they are acutely ill. Letter C. Patients who are unwell should be informed of care plans when well. Letter D. The patient should not be involved in the planning process. What is your answer? Letter B. Involve the patient in planning their care even though they are acutely ill. 16. In respect of fire safety legislation, what action does the nurse take if there are immobile patients on the premises? A. Ensure that immobile patients continuously sleep on the top of the glide sheet. B. Ensure that there is a wheelchair next to the bed of immobile patients at all times. Letter C. Ensure there is a personal emergency evacuation in place. Letter D. Ensure that immobile patients are situated nearest to the lift. What is the answer? Letter C. Ensure there is a personal emergency evacuation place. 17. Which pharmacological options are used for the treatment of alcohol dependency? A. Composite, diazepam, and amoxicillin. B. Composite, naltrexone, and disulfiram. Letter C. Composite, fluoxetine, and sertraline. Letter D. Diazepam, ibuprofen, and amoxicillin. What's the answer? Letter B. Composite, naltrexone, and disulfiram. 18. What are the signs and symptoms of hypoglycemia? A. Shivering, lack of coordination, slurred speech, removing warm clothes. B. Frequent urination, increased thirst, high blood sugar. C. Feeling weak, dizzy, tired, cannot concentrate, slurring speech. Letter D. Feeling sick, stomach ache and cramps, loss of appetite, constipation. What's your answer? Letter C. Feeling weak, dizzy, tired, cannot concentrate, slurring speech. 19. It is possible for early years and childhood experiences to impact on A. Life expectancy, education choices, and financial well-being. B. Life choices regarding career and physical well-being. Letter C. Life choices, mental, physical, and behavioral health and well-being. And letter D. Mental well-being and financial growth. What is the answer? Letter C. Life choices, mental, physical, and behavioral health and well-being. 20. What are the common symptoms that patients experience in their last 48 hours of life? A. Nausea and vomiting, agitation and upper airway secretions. B. Upper airway secretion, dyspnea, lucidity. C. Upper airway secretion, swelling in the extremities, and pain. Letter D, nausea and vomiting, pain, and an increase in appetite. What's the answer? Letter A, nausea and vomiting, agitation, and upper airway secretions. Thank you so much. Now, how many answers did you get right? Please comment down.